I think we might as well get started. Alice, welcome. How are you?
I'm well, thanks. Thank you for inviting me. So I'll start by introducing myself, and then I've got a presentation to share, which I'll do in just a second. So I'm Alice Clack. I'm an obstetrician and gynecologist by background, and I'm working at the moment with the Centre for Sustainable Healthcare and the Sustainable Quality Improvement Education team, which always feels like a bit of a mouthful. Thanks very much for inviting me here today to talk about sustainability and quality improvement. I'm just going to share my screen, which hopefully go out problems. Everyone's seeing my screen okay? Great. So it's just going to run through what it is, why we think it's important, and how you might go about using, or how you might kind of develop this in your area of work. This is just what I said. So first of all, what is sustainability and quality improvement? Well, really, it's what it says on the tin. It's about integrating environmental and social sustainability into quality improvement education and practice. And I've developed this slide really so that they can be shared. So they have a lot of links throughout for people to get more information. So there is a video here that you should be able to watch in your own time, which gives a kind of nice overview and can be shared with other people. What's really core to this concept is actually kind of reorientation to the way we actually think about value and quality, because traditionally we tend to think of quality and value as its impacts on the outcomes for patients or outcomes for the population. But with this kind of sustainability perspective, we need to kind of consider the environmental impacts as really core to what we consider as quality and value. And this has been recognised by the Royal College of Physicians, and they have included sustainability as one of their core domains of quality. And it's also kind of described in the what's fairly well known as the triple bottom line equation, in which rather than just looking at the outcomes of the patient and population in front of us, we're also looking at the environmental impacts, social impacts, and financial impacts. So we're looking to minimise them in order to maximise value. And this kind of perspective is also embodied in legislation like the Future Generations Act in Wales, which I think dates from 2015 or 16, which basically asks that the Welsh government considered the well-being of the future generations in every legislation that it writes. And this is given the climate and ecological crisis, we can't really be thinking now about healthcare narrowly in terms of those in front of us. We do need to think more broadly about the future as well. So the sustainability and quality improvement framework takes this kind of these concepts and the need to include environmental sustainability in change management, and it provides templates and tools to help health workers and educationalists actually do this. And the idea is that it's not about reinventing the wheel. Quality, the standard steps of quality improvement work don't need to be changed, but it's about trying to integrate those core principles and philosophies around environmental sustainability into those steps. And so fundamentally, what the SusQI framework does is it provides these tools and teaching guides to help the individual carrying out the project or the educationalist to apply the principles of sustainable healthcare, which were proposed by Francis Mortimer in 2010, to make changes that consider the triple bottom line. And I've got the principles of sustainable healthcare on this slide. So the principles are prevention, patient self-care, lean service delivery, and low carbon alternatives. And they are presented in the order of potential impact and importance, because we know obviously that if we're able to maximize health and prevent poor health, then that's going to drive down resource use far more quickly than if we tinker around the edges and swap. Not that these changes aren't important, but the higher impact changes are to be found around prevention and engagement with patients in their care. So why is it important? So it's important because whether we like it or not, the climate and ecological crisis is looming, and it's a health crisis which is already globally having significant impacts on human health, but is set to have increasing impacts over the next decade or two. And these are direct effects of climate change, such as the occurs due to excess heat or flooding, but also indirect effects due to things like crop failure, migration, increased conflict, and as well as globally, we know that the health sector contributes massively to, not only do we know that it's going to impact us, and therefore we're in this position of having to adapt to the challenges, the health challenges that the climate crisis is going to cause, but we also know that the health sector is a significant contributor to the environment, to environmental harm. So globally, 5% of greenhouse gas emissions result from the health sector, and that's true in the UK as well. 5% of UK carbon emissions result from the health sector. But we also have other significant environmental impacts. We produce a really significant percentage of the world's plastic. We a large amount of the travel in the UK is because of the health sector, patients, staff, visitors, and we also have impacts in terms of chemical runoff from the processes in our hospitals. So we have a responsibility to clean up our act, if you like. And this has been acknowledged by the NHS. It was the first health organization globally to set legally binding net zero targets, and we have net zero direct emissions by 2040 and by 2045 for indirect and direct emissions. And there's a lot to do. The majority of emissions in the NHS are actually influenced by clinical decision making. So obviously there's a massively important role around greening the estate. So improving energy use and insulation, ensuring that estate travel is electrified. But actually most of the emissions and harm are caused by the use of materials that we use within our clinical care pathways. So medicines, medical equipment, and other supply chain do represent the majority. And these are areas where health workers are key to making changes. And we know that QI is the framework for change used in the NHS, and therefore it kind of makes sense, therefore, that QI needs to address environmental sustainability. So in addition to the reasons discussed, increasingly health workers are also required to achieve competencies in sustainability as part of their training. And this is increasingly being demanded by health workers and students as well. So curricular examples include the GMC's outcome for graduates, which outlines undergraduate medical training, which must now include sustainability. The NMC standards of proficiency for midwives, equally, in the World Federation of Occupational Therapists minimum standards for education. There are increasing numbers of postgraduate examples of sustainability education, but the Faculty of Public Health has already has sustainability in its core postgraduate curriculum, and there's also a curriculum for core training and development, which will have sustainability and SusQI as one of its core domains. And I mentioned that it is being increasingly demanded as well by health workers and students. The Climate and Health Scorecard is a postgraduate trainee-led initiative, which is advocating and examining the work of medical Royal colleges and regulatory bodies in relation to relation to climate action, including education and SusQI. And the Planetary Health Report Card is an undergraduate student medical student initiative, which is putting pressure on medical schools to include sustainability and SusQI in education. So finally, there is evidence from the multi-centre evaluation. So the SusQI education project, which was co-led by the CSH over the last 4 years, piloted the integration of SusQI into undergraduate and postgraduate medical education and medical nursing and allied health professional education, actually. And a multi-centre evaluation demonstrated that it really increased the motivation of students to carry out quality improvement, and that students and educators really felt that it provided practical tools to turn kind of knowledge around the climate crisis into action, which is an incredibly motivating thing to do. And these are a few of the quotes from that evaluation. So it will be in my mind in day-to-day practice. I will constantly be thinking of changes in the way in which we can improve the healthcare system. I have more respect for the differences that can be made through quality improvement. And it is easy to feel hopeless with news of climate change. SusQI is valuable as it gives concrete ways in which we can make a difference rather than just learning about the problem. So I'm just going to quickly run through a little bit of the support that the Centre for Sustainable Healthcare has developed for those who are interested in trying to integrate sustainability into QI. So we have an open source website which has an educator pack and step-by-step guide, which is there just with lots of resources which are just there to be downloaded. We run a number of courses, including the Introduction to Sustainable Healthcare, SusQI, and a Teaching SusQI course. And they all run along the same model of being effectively a half day of self-directed learning and then a half day online tutorial. And there are then follow-up sessions for those who are developing projects. So it's definitely worth checking those out. We also have a package that's been specially developed for QI and educational leads to help them integrate sustainability into their QI teaching and practice. And this includes access to the SusQI and Teach SusQI course, or an alternative if you've already been on those courses. And then 10 hours of kind of one-to-one support to try and guide the individuals or institution to support the integration of the material, and also somewhat peer support from other members of the academy. And then there's the Green Ward competition, which is support to recruit and guide 6 clinical teams from an institution carrying out a SusQI project over 10 weeks. So that's a kind of 10-week project which helps to kickstart activity around SusQI usually in a trust, a hospital trust. Okay, so if you have, I don't know if we've got time. I've lost track of time a little bit, Adam, but I don't know if I've got time for questions. But if you
have time for questions,
got time for questions, I'll run through that quickly then. But do email or have a look at our website if you want any more information. And I'm happy for these slides to be shared. They have a lot of links in them, which will be useful to anybody interested.
Oh, I mean, that was brilliant. Thank you so much, Alison. It's so great to see so much work going on to integrate sustainability into quality improvement. I think it's I can't believe we've not been doing it like this for a while. I mean, climate's been on the sort of forefront of people's minds for decades now, and it seems odd that we're only just sort of approaching it now. If you've got any questions for Alice, please pop your hands up. If you aren't confident in coming forward and speaking, do pop them into the chat, and I can pose them to Alice now for you. The one thing I would like to ask Alice, and again, I feel like I champion social care. Well, social care is my bag, it's my baby, it's what I absolutely love. How for social care where quality improvement, especially for SMEs, is something that is still new to them now, how can social care get involved in this and really integrate sustainability into their quality improvement?
I mean, I think it would be through the same process, really. I mean, I would recommend anyone, first of all, have a quick look at the resources on the website, and come along to the Introduction to Sustainable Healthcare course, because it gives a really nice overview of where to start. But I think the first thing that you really the first kind of step, if you like, in QI is, okay, you might start with kind of deciding what area you might want to tackle. But the other is to have an understanding of your environment and where the environmental impacts are in your environment, and whatever area of work you're in, there's going to be slightly different impacts. So, for example, I'm in obstetrics, so I know that one of the hotspots will be Entonox, because Entonox has nitrous oxide in it, and nitrous oxide is an incredibly potent greenhouse gas emitter. But if I was working in social care, sorry, I'm probably going to have a lack of understanding of the area, but so, for example, it might be more the materials that I'm using. So it might be, and we know that materials are very harmful because they use a lot of resources and energy in their production, but then they also have to be disposed. So looking at what are the environmental hotspots in your area of work, studying that system, which is a very QI thing to do, study your system, decide where your hotspots are, and then think, okay, how can we tackle this to reduce the impacts?
That's brilliant. And just before I bring Raj in with his question, just a quick follow up on that then. So would you say sustainability in quality improvement is everybody's role in an organization, or is it just down to certain individuals?
No, I mean, I think it's everybody's role to now look to the future and transform the health service into something that's going to be sustainable, because if we don't do it, we're not going to be able to provide quality healthcare in the future. So there might be some people who are leading and will have it as their job descriptions, but any change takes a whole organization, because you can't have change without the willingness of the people in the organization to engage. And change can be difficult, especially when you're very busy and have other priorities. But this is important. So, yeah, so if you are working somewhere where somebody else is looking at this, please just help them and be as supportive as possible, because it can be very difficult, as I'm sure everyone here knows, to make changes.
Definitely. Thank you for that. Raj, I'll bring you in for your question.
Well, thank you very much. Thanks, Adam. Thank you, Alice. It was a wonderful talk. My name is Raj Madhukar. I'm a consultant co-worker surgeon at SWBH Trust in Birmingham. And I'm working on leading on certain of these project and audits for our own departments. I think I've seen one of these slides at the previous meeting and we're working on it. So my specific question is, we can't target all of the hospitals, so we have to choose one area, and I've chosen theatre to start with. Is there anything you would share, because you've already done some of these, to help us to create some project which will reflect some positive savings and obviously help us complete the project?
Yeah, I mean, there's been some great projects carried out in theatres. So I point you towards, if you've not seen the Green Theatre Checklist, I would definitely point you out towards that, because I think what's nice about that is it's exactly it's what it says on its tin. Ideally, every theatre will work its way down the checklist and eventually achieve all of those goals on it. And so it runs from everything from, turning off machinery that's not being used, to changing the gowns, to preventing unnecessary surgery. There's some good examples. There was on the CSH website, there is some good examples, because they supported the Green Surgery Challenge. I'm not sure if you've heard of that. So the Green Surgery Challenge was very much like the Green Ward competition. 6 surgical teams from across the country ran surgical SusQI projects. And there's some really nice examples from that. So it's probably somebody's shared the link with you. Somebody shared the link.
Somebody has. Is it? I was going on to your website.
And
so the website will have. So the website.
I'll share in just a second. I'll share the link for the Green Surgical Challenge, because rather than that, there's a number of case studies. So one of the teams looked at the appendicectomy pathway. Another looked at carpal tunnel pathways, and they were able to create a number of changes to their carpal tunnel pathway, which included direct avoiding admission to the ward, so direct admission to theatres, carrying out the procedure in a procedure room instead of in theatres, reducing certain number of surgical instruments that they used, so that their packs were much smaller and didn't require so much sterilisation. So there was a number of changes that all of the teams made, which really reduced the impact of their procedures. So I'll share you the link in just a second.
Yeah, I think somebody shared the Green Theatre, but thank you very much. Yes, I'll go through these, and thanks for that. We'll work on it.
Okay.
Thank you for your question, Raj. And honestly, thank you so much, Alice, for joining us today and sharing what you have done around SusQI. We'll make sure that your slides go out to everyone who's attended the conference today, and available with the catch-up watching as well, just so that everyone can take full effect and full advantage of all that knowledge that you've crammed into there for us. So thank you so much, Alice, for joining us. Everyone, go and check out SusQI.